Welcome back to PS213 Child Psychology. Chapter 3 is titled Prenatal Development, Birth, and the Newborn. It features 4 modules: from conception to birth, influences on prenatal development, happy birthday, and the newborn. Prenatal development, what does that mean? It refers to the transformations in a woman's body during the, on average, 38 weeks of pregnancy. Many of you have heard this broken down into divisions of trimesters: first trimester, second trimester, and third trimester. In psychology, we also refer to this timetable as period of the zygote, period of the embryo, and period of the fetus. Let's look at what happens in development when a woman provides, and this is key, when a woman provides a healthy environment for her baby. The period of the zygote lasts approximately 2 weeks when the fertilized egg implants itself in the uterine wall and establishes a connection with mother's blood vessels through the placenta. The placenta is a barrier and filter, and it allows the zygote to receive oxygen and food and eliminate waste. The period of the embryo begins about week 3, and by week 8, most body structures and human organs have developed in some form. The embryo rests in the amniotic fluid sac, which serves as a shock absorber and maintains a constant temperature. The umbilical cord develops, joining the embryo to the placenta, paving a highway for the exchange of nutrients and waste I mentioned earlier. The period of the fetus begins on average in week 9, and the body parts and systems formed earlier now begin to work. The brain starts to manage bodily functions. The fetus continues to grow much larger, and sometime after week 22, 23, 24, reaches the age of viability. This means that if the baby has to be delivered prematurely, there is a reasonable chance it might survive. However, it will have to be placed in neonatal intensive care for several more weeks for 2 main reasons. 1, babies delivered this early have very poor lung function, and 2, there's an inability to regulate body temperature. This is because a lack of body fat. It is during the period of the fetus that we begin to see some behavior. Movement inside the womb is common, but there are many individual differences. We know that the senses begin to work and memory begins to operate. Fascinating research shows that after birth, a baby can remember some events experienced in the uterus. One study demonstrated that 5- and 6-month-old infants preferred cereal flavored with carrot juice if their mothers had drank carrot juice several days a week during the last month of pregnancy. And in another study, pregnant women read aloud the classic Dr. Seuss story, The Cat in the Hat, daily during the last month of their term. After birth, newborns were allowed to suck on a special pacifier that controlled a tape recorder. They would suck to hear a taped recording of mother reading The Cat in the Hat, but not to hear her read other stories. It is amazing what researchers have learned about prenatal development in the past 15-20 years. The brain, sensation and perception, consciousness, learning, memory. There is so much more going on in the womb than we could have ever dreamed of. Module 2, Influences on Prenatal Development. There are 3 general risk factors to review, and these include nutrition, stress, and mother's age. Most women will have to gain 10 to 20 pounds to properly grow and develop a baby during pregnancy. Taking vitamins, proteins, and mineral supplements is now standard practice in prenatal care. Malnutrition during the last few months can put the baby at risk for neurological problems and physical illnesses. When we subject animals to chronic, inescapable stress, this leads to smaller and vulnerable animal babies. It would be unethical and unconscionable to do experiments like that on humans to try to make a cause and effect statement. But correlational research shows that mothers who have experienced prolonged extreme stress have babies that tend to be born prematurely and weigh less than average, and they tend to have more attentional and behavioral problems in preschool. Teenage women have greater problems with pregnancy, labor, and delivery. This is probably because they don't often have the money to get adequate prenatal care. But even teenage mothers who had good prenatal care and give birth to a healthy baby still have problems, including the kids doing less well in school and having behavioral issues. Is this because the teenage mom had to drop out of school with lowered income? Or is it because she already had personal problems? There's no single explanation why these kids from teenage moms do not seem to do so well. It's a complex and still hotly debated issue. So, what is the best age to have a baby? It appears that being in your early 20s through your 20s and early 30s is ideal. After the mid-30s, the risks of miscarriage and stillbirth increase. When a woman enters her 40s, 1/2 of all pregnancies result in miscarriage, and she's more likely to have a baby with Down syndrome. Teratogens. Teratogens are defined as an agent that causes abnormal prenatal development. And we know something about 3 primary types, including disease, drugs, and environmental hazards. Bacterial and viral infections can be very harmful. And while medication may help mother, it does not necessarily prevent the disease from spreading and damaging the developing baby. The best advice may be to not contract the disease before or during pregnancy. It is not hard to imagine how drugs of abuse, including heroin, meth, and cocaine, could harm a developing baby. But what is a surprise for some people is how legal drugs can also be dangerous, including caffeine, nicotine, and alcohol. Nicotine from cigarette smoking can result in low birth weight and cognitive impairments. Women who drink heavily can give birth to children with fetal alcohol syndrome. These kids, and when they grow up to be adults, have a characteristic facial appearance, and they too can suffer cognitive deficits, including mental retardation. Even women who drank lightly or moderately have produced children with these deficits. We don't know of any safe level of alcohol intake while pregnant, and the United States Surgeon General, the country's top doc, recommends abstinence during these 9 months. When you become pregnant, the best policy is to meet with your baby doctor and honestly lay out on the table all the psychoactive substances you may be taking, over the counter, prescribed, recreational, legal, and illicit. You have a discussion with your healthcare provider, and they will specifically advise you on what to do. A final teratogen is environmental hazards. Perhaps what is most unsettling about environmental hazards is that they are so often invisible, and we're unaware of their presence in the air, water, and food we take into our bodies. Lead and mercury in particular are being researched, and the government makes recommendations. What about radiation associated with computer monitors and cell phones? This is a hot issue, and it's in the news and being studied. But, as of now, the results are inconclusive. As we come to the end of this module, having discussed general risk factors including nutrition, stress, mother's age, and teratogens, diseases, drugs, neurotoxins in the environment around us, you may begin to get a little discouraged, wondering, how can I ever have a normally developed baby? Well, relax. The good news is most babies are born in good health. The key again is straightforward talks with your baby doctor as early as possible in the pregnancy. Better yet, during the period when you're trying to become pregnant. Module 3 is called Happy Birthday. The traditional approach to childbirth is that it was considered a medical procedure to be performed in the hospital. Mother may have been under the effects of anesthesia, and the expectant father took his place in the waiting room. But starting in the 1960s, the pendulum began swinging the other way, towards prepared approaches, also known as natural childbirth. Natural childbirth places much emphasis on education. Relaxation methods, including breathing and imagery, are taught in advance to be used in dealing with pain, and the role of medicine becomes secondary. The involvement of a supportive coach, often the father, who goes through classes and offers encouragement, is an integral part. And finally, if mother is healthy, with a normal, unremarkable pregnancy, and a health professional is present, it is not uncommon to do the birthing at home or some other setting outside of the hospital. Research shows that natural childbirth results in less drugs to control pain and more positive parental feelings about labor and delivery than the traditional birthing process. About 50% of new mothers experience intermittent irritability, sadness, crying for 1 or 2 weeks. Sometimes it's called the baby blues. This is considered normal since she's been under tremendous stress, there have been physical changes, and skyrocketed levels of estrogen. But if this progresses to an adjustment after a few weeks that features severe sadness, inability to function, difficulties with sleep and eating, loss of interest in usual activities, including the baby, then we consider the diagnosis of postpartum depression. That is not normal. We should seek out treatment for our new mother, for her own sake, and there's concerns about bonding and attachment with her new baby. Module 4 is titled The Newborn. A newborn cries on average 2 to 3 hours daily, and there are several types of cries, including basic, mad, and pain. Crying is the baby's first attempt to communicate, and new parents sometimes worry about how to manage the crying, but they soon learn to identify what the crying means and how to handle those issues. A new baby sleeps on average about 16 to 18 hours daily. A typical cycle is 1 hour of being awake and then 3 hours back to sleep, and this goes on around the clock. At around 3 or 4 months, just when parents think they're going to lose their minds from the exhaustion, a newborn usually starts to sleep through the night. But why does the baby need so much sleep anyway? They spend half their time in non-REM, which is deep and restorative, and the other half is spent in REM sleep. This is associated with consolidating learning and memory. We think REM stimulates the brain in some way to foster growth in the nervous system, and the baby is still largely growing a brain during that first year of life. As you can see from this graph, the percentage of REM decreases sharply after a few years. Another thing associated with REM is dreaming. Does the baby dream? Well, that's a good question. No one knows for sure because they can't tell us. But if the baby did have a vivid dream, long-term memory at this age lasts only 1 or 2 weeks. SIDS, or sudden infant death syndrome, is when a healthy baby dies suddenly for no apparent reason. Several thousand cases a year occur, and mostly between 2 and 4 months old. Risk factors include being born prematurely, parents smoking, the baby sleeping face down, and more of this happens during the winter. Researchers speculate, and this is only speculation, that it may have something to do with an inability to voluntarily turn the head when breathing becomes labored. But we don't know for sure. What is known for sure is that over the past 15 years, we've seen a 40% decrease in SIDS, likely because of public education to put babies to sleep on their back. Intervention has definitely helped in this area. Well, that's all for now. Join us next time in Chapter 4 on growth and health.